The Aveda Massage is designed for all elemental nature skin conditions, in particular water and earth natures. The techniques used in the Aveda Massage allow the body's own natural cleansing mechanism, the lymphatic system, to work at its best ability to remove wastes and toxins, decreasing the likelihood that they will manifest through the skin. Apply the appropriate, customized Aveda Massage blend, beginning at the décolleté, including the arms, and progressing upward until the entire neck and facial area is covered. Position the hands on the décolleté, forming a triangle with thumbs gently resting in the hollow of the clavicle. Ask your guest to take in deep, diaphragmatic breaths. Lean forward and apply pressure as the guest exhales. Release the pressure as they inhale. This allows for a better carbon dioxide-oxygen exchange. Effleurage across the décolleté, push down on the shoulders, slide down the inside of the arms, up the outside of the arms, over the deltoids and across the trapezius, up the back of the neck to the occipital hollow, and massage in circular movements. Perform several upper body hugs to relax the nerve endings, warm up the large muscles of the upper body, and release tension in this universal stress point area. The amount of tension the guest is exhibiting in the upper body will determine the number of upper body hugs you will need to perform. To enhance a deeper sense of relaxation, make sure you are connecting the skin with the entire palm of your hands, keeping in mind that the upper body hug movements are slow and the pressure is firm. Turn the head to the left and perform the half upper body hug. Effleurage down the side of the neck, pause and stretch the shoulder, slide down the inside of the arm and around the elbow, up the outside of the arm across the deltoids and trapezius, ending at the occipital hollow in massage and circular movements. Maintain constant firm contact in the hollow of the occipital with the opposite fingers as you repeat this movement several times. The half upper body hug reinforces the movements of the upper body hug with more specific attention given to the release of tension in the shoulders. Gently transition to the other side by supporting the guest's head and turning it to the right. Follow the same sequence of movements, making sure the palms of your hands maintain complete contact with the skin. Keep your pressure firm and your movement slow. Remember to pause and stretch the shoulders, which will further release accumulated tension in this stress point area. Maintain constant, firm contact in the hollow of the occipital as you repeat this movement several times. It is important to maintain a straight wrist whenever sliding down the inside of the arm to minimize unnecessary stress on the wrist joint. Transition the guest's head back to the center and perform the trapezius friction movement, which incorporates several massage movements focusing specifically on the trapezius muscle. Using your thumbs, slide back and forth across the base of the neck to the outer edge of the trapezius muscle several times. Make sure to keep your thumbs straight to avoid any unnecessary joint stress. Transition your hands around the shoulders and massage the trapezius muscle with the palms of your fingers. Gently transition your hands into a loosed fist and continue to massage the entire region with your knuckles. This movement will allow you to go much deeper into the muscle than any of the previous movements. Transition back to the center of the décolleté and activate the pressure point found between the breasts along the midline, close to the edge of the guest's gown, following the same activating sequence you have previously learned. Gradually applying pressure to the count of 3 in a counterclockwise direction, then to the count of 3 in a clockwise direction, then press and hold to the count of 3, waiting for the pulsed response. Begin to slowly pump out to the axilla region using the entire length of the pads of your fingers. Make sure to focus on gently stretching the skin while progressing bilaterally in small finger-width movements toward the direction of the axilla. It is recommended that you place either tissues or dry cotton pads in the underarm area to keep your hands sanitary while performing this particular movement. Cup your fingers and pump inward and upward several times. Slightly lean back and use your body weight to obtain the right amount of pressure needed in this area to stimulate the lymph nodes for effective drainage. Activate the next pressure point 1 inch above the previous point along the midline. Each pressure point in the Aveda massage is activated using the same rhythmic sequence previously explained. Continue to pump out slowly and rhythmically, stretching the skin toward the direction of the axilla region. Using the pads of your flat fingers, continue to pump out toward the axilla. Reposition the hygienic pads and clear the axilla region several times, keeping in mind there is a slight increase in pressure in this movement as you gently lean back, pumping inward and upward to stimulate the lymph nodes. Activate the 2 pressure points found between the first and second rib. These pressure points are separated by a distance of about the width of the neck. Follow the same rhythmic pressure point activating sequence, and then continue to pump, stretching the skin outward, working bilaterally toward the axilla region. Reposition the hygienic pads and continue to clear the axilla region by pumping several times, increasing the pressure slightly to stimulate the lymph nodes. Activate the 2 lung pressure points found 1 inch below the clavicle and 6 inches exterior to the midline. Be cautious not to use too much pressure here, as this particular set of pressure points can be somewhat sensitive. Continue to pump, stretching the skin outward and down toward the direction of the axilla. Reposition the hygienic pads and continue to clear the axilla region by pumping several times with slightly increased pressure to effectively stimulate the lymph nodes. Return to the center of the décolleté as many times as needed to completely clear the décolleté. Pump, stretching the skin, moving bilaterally in small movements out to the axilla. Continue to clear the axilla area, following the same rhythmic pumping sequence as previously described. Spend extra concentrated time pumping and clearing the axilla region after the décolleté has been completely cleared. Starting from the midline of the clavicle on either side of the sternal notch, pinch, twist, and slide along the clavicle outward toward the shoulders. Many lymph nodes are found along the clavicle region that need to be stimulated. Continue to pump down and out toward the axilla. And once again, continue to clear the axilla region with the pumping sequence. Transition your hands around the shoulders to either side of the spine. Slide down either side of the spine to the 2 points on the back opposite the sternum. Using the pads of your fingers with firm pressure, pump upward, moving along either side of the spine to the hollow of the occipital ridge. Activate the pressure point located in the hollow at the center of the occipital ridge, following the same sequence previously explained. Turn the guest's head to the left. Activate the pressure point known as bladder 10 on the bladder meridian channel, located to the right, lateral of the central pressure point previously activated. Then turn your hand over. Using the backs of the fingers, gently pump down the back of the neck. Notice how the back of your hand completely conforms to the contours of the neck, allowing for maximum contact and drainage to take place. As you approach the hollow of the clavicle, slightly pivot your hand position so you are better able to pump under the hollow of the clavicle. Repeat this pumping several times and then change direction to pump toward the sternal notch. Transition and activate the next pressure point lateral along the occipital ridge and then pump down to the clavicle. Make sure your hand conforms to the shape of the neck as you gently and slowly pump down the side of the neck. The progressive movements are small and overlapping to ensure effective results. Observe the slight pivot in the hand position as you approach the hollow of the clavicle. Repeat the same rhythmic sequence, directing the movement finally toward the sternal notch. Place the entire palm of the hand at the earlobe and continue to pump down the side of the neck toward the clavicle region. Continue to clear the clavicle with several pumps directed underneath the clavicle and several pumps directed toward the sternal notch. Continue to clear the side of the neck by repositioning the entire palm of your hand under the mandible bone. Continue gently pumping down the neck and following the same sequence. Transition the guest's head to the right and repeat the same sequence on the left side, starting with the pressure point known as bladder 10 on the bladder meridian channel. This time, just lateral of the center pressure point and progressing downward. Make as much contact with the contours of the neck as possible, continuing to follow the same sequence, completing at the clavicle. Transition and activate the pressure point along the occipital ridge, lateral to the previous point, and then pump down to the clavicle and clear again at the clavicle region. It is important to keep in mind that you are focusing on stretching the skin and not sliding over the skin. Pay special attention to this when using the backs of your fingers. Take the time to completely clear the neck region using the palms of your hands, maintaining constant contact. By clearing the neck region, you open the channels for proper drainage to take place in the facial region. Because there are more lymph nodes found in the neck than in the facial region, It is important to be very thorough in your movements in order for the massage to be effective. This approach is very effective in minimizing any edema or swelling that oftentimes can take place in these regions. Be sure you have cleared both sides of the neck completely before moving on to the facial sequence. Return the guest's head to the center. Position flat fingers along either side of the middle of the chin. Curve your fingers around the mandible and continue to pump bilaterally along the jawline and out toward the ears. Maintain the same rhythmic movements until your index finger is in front of the earlobe. Begin to pump the earlobes. Firmly and slowly, pinch up and down the outer ridge of the ear. Then pinch up and down the middle ridge and complete the ear massage by activating the inner portion of the ear using a gentle pumping movement. Scissor the ears by positioning the ears between your middle and ring fingers. Apply firm pressure. Slide back and forth, maintaining the same firm pressure several times. This is an Ayurvedic technique. Activate the pressure point found at the temporal mandibular joint. The location of this point is approximately 1 finger width anterior to the earlobe. After activating this point, pump bilaterally behind the ears. This action will stimulate the parotid nodes in front of the ear. Continue pumping down the sides of the neck with the backs of the fingers, maintaining the contact with the contours of the neck, and clear the clavicle with several pumps directed underneath the clavicle, and then several pumps directed toward the sternal notch. Activate the pressure point below the lower lip at the midline. Pump out toward the earlobes, using the same slight stretching movement of the skin as you pump. Activate the pressure point located along the midline between the nose and the upper lip. This pressure point, found on the governing vessel, helps to energize both the left and right sides of the face. Make sure to use gentle pressure when working around the mouth region. Continue to gently pump out bilaterally toward the middle of the ear using the pads of your fingers. Use more of your fingertips as you continue to pump out. Activate the pressure point located at either side of the flare of the nostrils. This point corresponds to the large intestine 20, the 20th point on the large intestine meridian. Pump out and activate the next pressure point, which is located in line with the pupil of the eye, just below the zygomatic arch. This pressure point is also known as the third point on the stomach meridian and is located directly on the stomach meridian channel. Continue to pump bilaterally along the zygomatic ridge toward the direction of the center of the ears. Place your fingers at either side of the bridge of the nose. Using the middle fingers, pump down the sides of the nose to the pressure points found at the end of the cartilage, approximately in the center of the nose. You will feel a small indentation. Activate these points and then continue to pump bilaterally underneath the eye region toward the middle ear, gently stretching the skin. Reposition your fingers at the bridge of the nose. Pump bilaterally down the sides of the nose to the inner corner of the eye. Then continue to follow the orbital bone underneath the eyes, pumping outward toward the hairline at the top of the ears. Using the pads of your flat fingers, pump down to the mandible region behind the earlobes. Continue to pump down the sides of the neck with the backs of your hands, down toward the clavicle region. Here you will clear the clavicle with several pumps directed underneath the clavicle hollow, followed by several pumps directed toward the sternal notch. Activate the pressure points known as bladder 2, or the second point on the bladder meridian at the medial end of the eyebrows. Pinch laterally along the eyebrows to the temples. Reposition fingers at the center of the forehead above the eyebrows. Pump out towards the temple area to the hairline. Continue to return to the midline of the forehead and pump out bilaterally toward the hairline. Continue until the entire forehead is covered, following the same rhythmic sequence. On the final forehead movement, continue to pump all the way down the perimeter of the face. Go down to and behind the earlobes. Continue down the sides of the neck using the backs of your hands, down to the hollow of the clavicle. Pump at the hollow of the clavicle region where you will clear the clavicle with several pumps directed underneath the clavicle hollow and several pumps directed toward the sternal notch. Continue to pump down to the axilla region. Position the hygienic pads and clear the axilla region several times. Return to the forehead and pump back to the crown along the midline in a press, release, and slide movement. This completes the Aveda massage.